Hi, I'm Kathi Kinnett. I work with PPMD as their Vice President of Clinical Care. And PPMD has worked really hard to strengthen clinical care, and I'm really happy to be able to share their last development in this effort, and that's the creation of the Certified Duchenne Care Center program. So if I can get this to work. Yay. So I'm going to start off by just giving a little bit of background to this effort. As many of you know, the first meeting of the Transforming Duchenne Care Initiative took place 2 years ago in Florida in 2012, and that effort included a group of 53 people representing 17 institutions, advocacy, industry, patients. So we had a room full of people who were all interested in reducing discrepancies in care across the United States. There were 4 key themes that came from that meeting, and the first was that there are discrepancies in care across the United States. This doesn't come as any big surprise. There are also discrepancies in models of care across the United States, so everybody's clinic, everybody's center does not look exactly the same. There are discrepancies in the implementation of standards of care. Every clinic is trying to do a very good job, but they're all doing it just maybe a little bit differently. And all of these discrepancies are impacting both clinical care and clinical trials. So the Transforming Duchenne Care Initiative was formed to address these 4 key themes. The first part of the TDCI had 2 phases. The first was to address transparency of clinical services and subspecialty care, and the second to address transparency in clinical care. And then the 2 later phases were added. And I'm going to go through these just kind of quickly and explain all of them if I can. Maybe. There we go. Okay. So the first key theme was that there were some discrepancies in models of care. And so in order to address those discrepancies, we decided to look at making the clinical and subspecialty services that are available in centers transparent. And in order to do that, we have developed the Clinical and Subspecialty Services Survey. So this survey goes to centers to identify both structure of the clinic and clinic infrastructure. So the structure is where is your clinic, what providers and services are found at your clinic, what providers are on your team, what's available through your center on the day of clinic, and then your infrastructure, how do I get a hold of you, if I've got questions, who do I call, how are visits managed, and how does patient flow manage. So the MDA care pages do have some information regarding their centers, and they're wonderful. The Clinical and Subspecialty Services Survey addresses Duchenne-specific issues regarding Duchenne-specific care. So now we know who's on the team, and now we need to know what they're doing. So in order to address discrepancies in clinical care, we decided to make that more transparent, and the way to make that more transparent was to develop the Duchenne Care Survey. The TDCI determined that there are 5 domains of care that need to be included in order to offer comprehensive care to patients and families. And those 5 domains include coordination and communication, neuromuscular care, which can be provided by a neurologist and or a physical medicine rehab specialist and or a OT and a PT. There also needs to be a cardiologist on the team, pulmonologist on the team, and endocrine and bone health. So measures were created for each of these subspecialties in order to evaluate care that's being provided in each of those subspecialty areas. So now that we know who's on the team and we know what the team is doing, what care is being provided, we needed to evaluate whether that care was being provided in agreement with the care considerations. And so the third part of the TDCI is the creation of the Certified Duchenne Care Center program. And the mission is to certify and identify and certify centers across the United States who are providing comprehensive care and clinical services to people living with Duchenne, and to communicate that knowledge to the Duchenne community, and this includes everyone. So to make this knowledge publicly available to patients, families, caregivers, national organizations, private and publicly held companies, government institutions, industry, and other key stakeholders. The CDCC program is overseen by an advisory board, and that advisory board has worked together to develop the standards for certification document. Currently, that advisory board includes myself, Dr. Lawrence Charnas from Shire Pharmaceuticals, Ellen Wagner, who's on the PPMD board and also a parent, and Dr. Jim Dowling, who was at Michigan and is now at Sick Kids in Toronto. So we've worked very hard to develop the document and also to develop center metrics. So these center metrics are process measures that cover each of the 5 domains. They're collected annually, and they will demonstrate continued efforts of the centers to improve the care and services to the families that are served by that center. These are the metrics. There's no test. These, again, cover each of the domains. They're fairly short. There's 8 metrics. They're objective measures. Those numbers can be obtained from the electronic medical record. So we can get these metrics annually. They'll be published online on the PPMD website, much in the same way that the CF Foundation has published their information. And the purpose of publishing these metrics is to let centers evaluate how they are doing in comparison with themselves longitudinally, as well as how well they're doing in comparison with other certified clinics, and to let the public know how each of these centers is doing. So the culmination of the first 3 phases is the creation of Duchenne, Certified Duchenne Care Centers. So we've identified who's there, what they're doing, if they're providing care in agreement with the care considerations, and now to certify those centers. And the purpose of certifying the centers is to create a network of centers across the U.S. that are providing standardized care, again, in agreement with the care considerations and in agreement with the certification standards. So there's the 4 phases, and it's been a 2-year project. It's ongoing, and it's very exciting. So why is certification important? Well, it's important to optimize care for all kids with Duchenne. It's important to optimize care for all families that are living with this diagnosis. And it's really important to standardize care across the country. You should know that if you go to one Certified Duchenne Care Center, you will be receiving the same care that you'll receive at another Certified Duchenne Care Center. And the purpose of this is not to take patients away from any center, but to increase patient access across the country so that more patients will have access to certified or to comprehensive care. Again, if we reduce variations in patient care at these centers, many of these centers are clinical trial sites. And if we can reduce variations in patient care, then we hope to be able to reduce variations in clinical trial outcomes at these clinical trial sites. So this will help to speed up research and make those results, strengthen the results. So the certification process is not an extremely difficult one, but it's not a short one. We wanted this to have meat, so we wanted this to mean something. We didn't want to just say, you're certified, create a center or a network of 50 centers. We wanted it to really mean something that you were a Certified Duchenne Care Center. So the first part of the certification is application. Application is fairly short, and there's also the requirement to complete the Clinical and Subspecialty Services Survey and also the Duchenne Care Survey. So once the certification committee has these documents, we have the ability to sit down and say, do you meet the initial requirements for us to even consider you as a comprehensive center? So in order to apply, you must have a center director. You must have clinic coordination, and preferably that's done by a nurse or a nurse practitioner. You must have a neuromuscular specialist, and again, that can be either a neurologist or a physical medicine and rehab provider who has an interest in training in Duchenne, knowledge in Duchenne. You must have a cardiologist available at that center, pulmonologist, genetic counseling, physical therapy, and social work. And those people need to be present and available on the day of the comprehensive clinic visit. They don't necessarily have to be in the same clinic, although that would be lovely. But if they can't be available in that same clinic, they need to at least be available on that same day. Centers also need to have access to these other subspecialties, so GIGU, orthopedics, palliative care, endocrine, surgery, DME. So again, we want these clinics, these centers are comprehensive. They're able to meet the needs of patients and families throughout the spectrum of disease and in all subspecialty area. Once we have those surveys and we know that centers have met the requirements for people on the team, then 2 members of the certification committee will go for a site visit. And the purpose of the site visit is through interviews and chart review to support the information that that center has given us in the surveys provided. So we go and see the facility, we talk to people, we validate the information that we've gotten, and then we look at the charts in order to see if what care has been reported to us has been documented. Once we have all the information, then the certification committee meets on a conference call, and if they're deemed to have met all the requirements for certification, then they will be certified, and they will be certified for 5 years. Currently, centers are receiving a small stipend, and that stipend is only to be used for Duchenne-specific programming and quality improvement. And the use of that stipend has to be reported annually, and it will be strictly guarded. Another requirement of centers is to encourage and enable patients and families to register and update their information in Duchenne Connect, and also to have families complete a clinical experiences survey that's new, so that we can validate from the family's perspective what care is being provided. And then clinics are encouraged, or no, have to annually update their subspecialty clinical and subspecialty care surveys, as well as the care survey and their center metrics, so that we can make sure that even though they said they're doing what they're supposed to be doing initially, that they're continuing to do that. And the center metrics show us that they're continuing to try to improve that care. Patient and parent participation is really important. So Duchenne Connect, again, the registration is important to let us know that families are aware of the resources that are available to them, that they are available and input into this registry, so that if clinical trials come about, they're able to be contacted. We want to make sure through the registry information that, again, parents are supporting the information that we're receiving from the clinics. And the clinical experiences survey is just very short, I think 20 questions, very multiple choice about the care that's being received. And the clinical experiences survey will support the center metrics and also the information that is given to us in both of the surveys. So as you can see, this is a continuous effort to try to ensure that the Certified Duchenne Care Centers are providing comprehensive care. So they will tell us what they're doing. We will go and visit and demonstrate, hopefully, that they're doing what they say they're doing. And then we're depending on you all to let us know whether or not you're perceiving and receiving the care that's being reported and that we heard about and saw during the site visit. So it's very important that you all are involved. We want this to be a usable tool for everybody. We want this to benefit everybody. So this is year 1, and we have 2 Certified Duchenne Care Centers right now. The first one is Nationwide Children's. That program was certified in March. And the second is Children's Hospital of Colorado that was just certified a couple of weeks ago. So there are 6 other institutions that will be certified before the year is up. Cincinnati is next, and then Seattle is next. So the first picture is Children's Hospital of Colorado, and then nationwide. So I'm very proud of this effort. I hope that you all are excited as I am about it, as we are about it. And if you have any comments or questions, I'm happy to take those now. Thanks.